This is an 18-year-old female with a microscopic polyangiitis, and she's been on azathioprine, so she's mildly immunocompromised. She presented with 3 weeks of a waxing and waning cough and respiratory symptoms, and she was treated by her PCP with azithromycin for 5 days, and then when she wasn't getting better, switched to Augmentin for 10 days. And still, her was having increasing work of breathing and shortness of breath, so she was referred into the hospital where we saw her. And really, her exam was most notable for this very, very prominent cough and had these decreased breaths on her left. Her labs were notable for a very high ESR and a very high CRP, and she had a respiratory pathogen panel that was positive for SARS. She had a really fabulous infectious disease history. So she lives on a farm with goats and chickens and dogs and turtles and ducks, all of which she has contact with. She was recently involved in birthing of her goats. She attended in the past month a 4-H camp where she was around a lot of cattle. She also visited a water park, and she confesses to drinking lots of unpasteurized goat milk. And then she got a CT and a chest X-ray, which showed this necrotizing left lower lobe pneumonia, which I love it when our radiologist tries to diagnose things microbiologically, but said this is most commonly seen in the setting of Klebsiella pneumoniae. So when we saw her, we started her on levofloxacin for atypical pathogens and remdesivir for her SARS infection. She got a BAL, and so we didn't show really any evidence of her underlying autoimmune disease, so no pulmonary hemorrhage. And we sent a Karius. And you can see there, 2 days later, her Karius was positive for something that we really weren't expecting. It was Nocardia at a very high level. And we were able to switch her to linezolid to broadly cover for Nocardia while we were waiting for our subduals to come back. And she was discharged home shortly after that. 3 days after she was discharged, her BL culture did also come positive for Nocardia, sort of confirming that diagnosis, but at a much later point in time.